Hey there, Dr. Atkin here, chiropractor and master herbalist at Family Focus Chiropractic, and today we're going to talk about when to use heat and when to use ice. So my patients come up to me all the time, they say, okay, Dr. Atkin, do you want me to use heat or do you want me to use ice? And let's keep this very simple. Heat increases blood flow. It increases circulation, increases fluid accumulation. Whereas ice reduces blood flow, decreases the inflammation in the area, and decreases the circulation. So if you just sprained your ankle and it's blown up like a balloon, do you want more fluid and more circulation in the area or less? Well, you want less, right? That's where ice comes in, and ice is important at reducing blood flow, reducing circulation, and reducing that swelling and inflammation. Now, once we don't have that big old swollen joint there anymore, sometimes joints who have been chronically injured over time, sometimes we want to increase blood flow because what does blood bring with it? Well, it brings with it nutrients and building blocks for tissue growth. So when you have an acutely injured area, joint, you want ice on it for at least the first 48 hours. After that, when there's a chronic injury, perhaps some heat is going to be what you want in the area. The other thing to think about is that if it's inflamed and it's a joint, it probably wants ice to reduce that inflammation. However, muscles are a different story. Muscles often do better with heat. For the same reason that you warm up before you exercise, we want to warm those muscles up, increase that blood flow so that healing can take place. So for example, when somebody has just kind of some soreness along their upper traps, that's why your massage therapist or when you're at home, that's why they might put a hot pack right along the back of your back because they're looking to increase flow in those muscles. So once again, muscles like heat, swollen joints like ice, ask yourself the question, do we want to increase blood flow or do we want to decrease blood flow? So then the next question becomes, okay, so how do I use ice? How long do I use it? Well, you want to use ice preferably for at least 20 minutes. 20 minutes on, 20 minutes off, 20 minutes back on. So let's say you're swollen right at the very base of your neck there, right over the spine. You're going to put an ice pack on it over the course of an hour. You're going to go 20 minutes on, 20 minutes off, 20 minutes on. Now, with ice, regardless of what joint you're icing, we don't want to just get the skin cold. We want to get it deep and cold. In fact, to the point where it's almost painful and numb. Granted, you don't want frostbite, so certainly put a layer in between the ice and your skin, but you're not going to wrap it with 15 towels. Now, I don't care if you get, a package of peas from your freezer, you get a bag of ice, there's all kinds of different ice devices you can buy from, Walgreens or whatever store that you have nearby, but you want that deep and cold for 20 minutes. When it's acutely injured, you may be doing this 3 to 5 times a day. As time progresses, you might reduce it to once or twice or really as often as you can. When it comes to heat, you can use dry heat or you can use moist heat. Moist heat, for example, would just mean, take a towel and, put it in a pan of hot water, wring it out. You don't want to burn your skin, but put it on as hot as you can and then just let it rest there. And after 10, 15 minutes, it's going to have already gotten cold. And that's a good amount of time, is 10, 15, 20 minutes. When you're using a heating pad, it may not be as effective because it really doesn't get that heat doesn't get into the muscles quite as much or quite as quickly, but you're going to want to use that heat, for once again, maybe 15 or 20 minutes to increase that blood flow. So those are a couple really important pointers. Keep those in mind. Of course, if you have any other additional questions, feel free to give us a call, shoot us an email, just ask us at your next visit, but that should give you a good start as to when you should use ice and when you should use heat. Thank you and have a great day.